The government is turning to private healthcare firms in a bid to cut NHS waiting lists, which now have soared to 7.47 million people. Let's talk about this with Tony O'Sullivan. Tony is co-chair of Keep Our NHS Public, and he is a retired paediatrician. Good evening.
Good evening. How are you?
Very well, thanks. So if the NHS can't cope, why would allowing private firms to tackle the waiting list be counterproductive?
Well, firstly, the big question is why the government is investing in private firms when it should be investing in the proven model of the NHS, when we know that when it was well funded, it was efficient, effective, giving the best value for money and offering high quality care to the whole population. The private sector is very small, relatively speaking. For example, it uses 17,000 doctors around the country compared to 338,000 in the NHS. And I say uses them because they don't employ, most of their staff aren't employed directly. They're actually agency doing sessional work, and the vast majority of them come from the NHS. So whatever the private sector picks up from the NHS, it's taking staff away from the NHS, which is already really, really struggling. So in fact, the relationship is parasitic rather than supportive.
So the doctors that you would go and see as a private patient are the same doctors that you would see if you'd waited longer on the NHS. So we're buying the same thing, but at a higher price.
Yes, we are. And we know from bitter experience the problems with long waiting lists are not a new thing. In the years of the 80s and 90s, the NHS was seriously underfunded and was similarly facing really terrible long waits and trouble in A&E. And when the government changed in 1997, for a period of time, through the 2000s, the NHS received funding between 6 and 8% uplift a year and started to be a really effective, efficient service. And by the end of the 2000s, the waiting times had pretty well been removed as a problem. So you got referred to hospital, assessed and treated within 18 weeks, and in A&E you were seen within 4 hours. The vast majority of people, in huge contrast to what is going on now. So we know it's the model that works, and you have, if you fund it properly and you have enough staff, and those staff are paid properly and respected, then they will give the commitment to the NHS that the population needs, and you don't have a two-tier system of private operators who, in fact, they cherry-pick the low-risk, high-volume procedures that they can get the most money from, and they not only take staff away from the NHS, they take that staff time away. The anaesthetists, the surgeons can't be in two places at once. But not only do they take those staff away, but they take the funding from the NHS for those patients away, and they leave the more complicated, vulnerable patient groups in the hands of the NHS. And whenever anything goes wrong in the private sector, they don't have the intensive care rescue facilities, and they transfer 6,500 patients a year back from the private sector into the NHS, where the NHS has to fund the consequences of those problems to the tune of over 80 million a year.
Am I right in thinking that the government is actually guilty of cooking the books here? Because they say that we are spending record amounts of money on the NHS, but is it correct to think that the money that they're spending actually includes all of the billions that have been wasted on PPE that either didn't work or didn't show up, and the money that they are now spending with the private healthcare companies? So when they say that NHS spending has gone up, it's not actually going to the NHS.
Well, you're absolutely right in nailing that. There was gross necessary funding for COVID, but a vast majority, a huge amount of money went into the private sector and was wasted. And that's in a way an ideological position, a choice that the government has carried on. So that they've given a 4-year contract to the private hospitals for £10 billion to see NHS patients in private sector settings, and they get 30% of their funding from NHS funding, from seeing NHS patients treated by NHS doctors and nurses and anaesthetists and theatre staff who would be working in the NHS if they had the theatres opened, the wards opened, properly staffed and properly paid. But the other thing to say is that the funding, if it were put into the NHS, would allow the NHS to expand itself for the long term. So you need a long-term solution to the needs of the population. And if you include the growth of the population and the growth of complexity of the needs of the population, the actual funding per person in the NHS has started actually to flatline and go down. So it's true that it's record funding, but it is not record funding for the need that is there. The funding per person for need has actually faltered and gone down, and that is why the NHS is in real trouble.
Let's talk about the tests specifically now, because that is what much of this 7.47 million waiting list is for, to actually not to get the treatment, but it's to get the tests to see whether the people need the treatment. And it's part of the reason is because we don't have enough MRI machines and other scanning machines, certainly compared to our European neighbours. Now, if people get their MRI tests performed privately, do we actually have the radiographers to read those tests?
Well, the radiographers to do the tests, and the radiographers or the radiologists to read them and to give the results promptly are in real short supply. And the radiographers have been the latest group of NHS staff forced to go on strike recently. And I was talking to them at the King's Hospital picket, and they were saying that they were really worried about the short staffing in their departments. That's the NHS staff departments, and they were really worried about the hemorrhaging of their own staff. As you say, radiographers, radiologists, and it's across the NHS, who are either going to leave the country or are going to give up the healthcare altogether, or are going to go and work in the private sector where the conditions are easier and kinder and per session are better paid. So it's a travesty.
Right, so if people can get their tests and they will be relieved by that, but having had their tests, we don't have the staff to actually decode whatever it is that they show, then they're still on a waiting list.
You're absolutely right. I mean, there's another deception of the statistics going on. You know, as you reported earlier on, there's nearly 7.5 million patients, and they're real people, every one of them, on the waiting list. And the government's, in a way, cooking the books, because they're saying that they've got rid of 2-year waits and they're en route to get rid of 18-month waits. But the numbers of people going up is actually increasing all the time. So the numbers of people who are waiting less than 18 months are soaring, and the government is saying that it's met its target. So that is another cooking of the books, if you like. The only thing that will get rid of the waiting lists will be an expansion of the NHS. Funding the NHS staff will stop the hemorrhaging of staff. 170,000 NHS staff left the service in the last year, about 40,000 nurses. There's a real worry that over 40% of junior doctors who are qualifying are thinking that they will either give up medicine or go abroad or do something else. And I think that's a shocking failure of the government. It's been on their watch for 13 years.
Do you think that we're sort of losing sight of where we used to be as far as the NHS is concerned? Because you've already alluded to the point that it used to be the waiting list used to be smaller. The amount of satisfaction in the NHS used to be greater. We topped an international comparison site of various medical services. And this was all in 2010, at the end of the Blair-Brown era, when the amount of money that was put in the NHS per year, I think, was inflation plus 4%, something like that. At the moment that David Cameron came in, and subsequently, the NHS has been sort of starved of funds. So the government will say that it's not just money. We have to have reform, and we have to find efficiencies and so on. But actually, it is just money, isn't it? Because the people were the same, the hospitals were the same, the beds were the same. The only difference between then and now is the amount of money spent per person in this country on a health service.
There's been a drive, which is part of austerity, but there's been a drive to damage the levels of funding in the public sector and in the NHS that actually costs lives. And at the end of the Labour government period up to 2010, the funding in those latter years had actually been over 4%, Nick. It was, the average for the previous 10 years had been 6 to 8% per year, on average about 6%. And over the lifetime of the NHS, it's been about 4% a year, as you say, on top of inflation, to keep pace with the growing population, the growing needs, and the level of expertise that is available to patients through the NHS. So that is what is needed, because we know it works. So the NHS as a model, as a way of delivering healthcare to the whole population, that model does not need reform. What needs reform is the policies of the government that are trying to undermine it and to bring in the private sector into the NHS, and that in effect contributes to a two-tier system.
It appears from the outside as though the government has identified NHS workers as a target in their war on lefty wokeism. How is that affecting morale, do you think?
Well, there's a very, very serious impact on morale. You know, I've talked to people, I've seen people in tears. We've all heard those tragic stories. The work that they went through, I mean, I was retired when COVID struck. I retired in 2016. But knowing what they've gone through, talking to people, reading about it, they put their lives on the line. We know that nearly something like 2,000 health and care staff died in the line of duty during COVID. They worked they worked themselves to the bone. They saw their colleagues dying, they saw their friends and relatives dying, but they supported the population. And then at the end of that, the government kicks them in the teeth and refuses to even keep pace with inflation for their pay awards. So many of them have lost anything between 10 and 30% of the value of their pay, but even more than that, and they say this on the picket line when you're talking to them, even more than that, they are traumatized by the demise of the care that they're able to give. The waiting times are going up. The vacancy rate means that they know when they go into work each day, they may not be able to give the level of care to the patients that they know they should be and that they were trained to. And that's a kind of real moral injury that they carry around with them. So the demoralization is serious, and you cannot blame people for wanting to get out of that stressful situation. I just hope that enough staff hang on in there until there's a change of political direction in this country. But I do hope that if there is a change of government, they will not set about proselytizing that the need is to reform the NHS. The need is to stabilise it, to give the staff the respect they deserve, to pay them properly, to get those vacancies filled, to reopen the beds that were closed, reopen the theatres that are closed, repair the ceilings that are falling down, build the capacity of scanners, CT scanners, MRI scanners, that are several times fewer than in Germany, and to get the NHS back on track, because we know, as you've said, when it was like that, it's the best in comparison across the world for the more economically advantaged countries like the OECD countries.
We used to say, well, we still do sometimes, but it used to be justified to say that the NHS was the envy of the world. We talked earlier on about long-term planning. Just finally, as far as long-term plans go, since 2010, the Conservative Party have underfunded the service. They have continually attacked nurses and doctors and consultants. They've presided over a reduction in the numbers of staff, making it more difficult for them to cope. They've removed bursaries. Does it look like a systematic and deliberate attempt to destabilise our health service?
Well, those of us that support and campaign for the NHS are often accused of being conspiracy theorists. But there's no secret conspiracy any longer. The Conservative government has been absolutely out in the open that they say that the NHS can only survive in partnership with the private sector, and they should be hand in hand with the private sector and welcome it. But when you know your facts, you know that the private sector cherry pick, they take staff from the NHS, they minimise their own risks. It's their model to make a profit, so they take money out of the NHS. And that approach by this government has got to be kicked out.
Tony, very good to talk to you. Thanks so much for your time. Tony O'Sullivan, co-chair of Keep Our NHS Public and a retired paediatrician.